This presentation will provide information on the placebo effect, and in particular, what effect a placebo has on skeletal muscle strength and endurance in college-age men. This study was conducted to determine whether or not the results of a placebo would change the results of an experiment prior to and following the knowledge of the placebo. The placebo effect, also called the placebo response, is a phenomenon in which a placebo, a fake treatment, can, in some cases, improve a patient's condition simply because that person has the expectation that it will be helpful. The expectation involved with the placebo effect plays a large role in the effectiveness of this treatment. The more someone believes that the treatment will be beneficial, the more likely that the person will gain benefit from it. A placebo can be used in many different ways. The most commonly used form is through the use of a sugar pill or a faux injection. However, there are many other forms that can be used, including special diets, exercise, physical therapy, or even surgery. The placebo effect has long been used to test the efficacy of a new health care treatment, such as a drug. In order to accomplish this, two groups are generally formed, whereby one is to take the drug and one group is to take the placebo. Usually both groups are unaware of which one they have, or in some cases, neither group is aware a placebo even exists. Sometimes a double-blind test is incorporated where neither the subjects nor the researchers know which group has which substance. Comparing the results from both groups should indicate the effects of the drug. However, in some cases, beneficial signs are shown in subjects who have taken the placebo. This is called the placebo effect. An example of this can be shown in an experiment conducted in 2008 by Harvard Medical School, where volunteers with irritable bowel syndrome, or IBS, were experimented on to determine if a relief of this syndrome would occur when treated with the placebo. The placebo treatment was sham acupuncture, which involved needles that retracted into their handles rather than penetrating the subject's skin. The results of this experiment were impressive, with 44% of the people admitting to a relief of IBS. The study provided in this presentation will determine the effect that a placebo has on skeletal muscle strength and endurance on college-age men. As shown in the above experiment, a large number of participants were affected by the placebo. This experiment will not only show the results attained from exercising for skeletal muscle strength and endurance, but also whether or not a placebo effect will be a result when a placebo is incorporated. This experiment will be undertaken in 3 trials, where the subjects will be unaware of the placebo until the second trial. The third trial will discover whether or not the placebo has worked. It is hypothesized that when the placebo is taken, then the subject will receive an increase in results for the second trial, and when the subject is aware of the placebo, then the results will decrease for the third trial. A within-subjects design was utilized to investigate the placebo effect on upper and lower body skeletal muscle strength and endurance in a group of college-aged men. In an attempt to minimize a learning effect, participants were familiarized with each of the testing procedures: 1 repetition maximum, 1 RM, bench press, and 1 RM leg press, as well as maximal repetitions at 80% of their 1 RM max for bench press and leg press exercises. Following familiarization, baseline testing was performed prior to the testing sessions. During each of the testing sessions, participants were administered a sugar tablet. To initiate the placebo effect prior to the testing session 1, T1, participants were told by an experimenter they were consuming a supplement composed of powerful amino acid compound that has been proven to increase skeletal muscle and strength and endurance by 10 to 15%. Following completion of T1, the placebo effect was removed by having the same experimenter tell participants. Another university just completed an independent study of the supplement and found the supplement to have no effect on skeletal muscle strength or endurance. the supplement does not work. Participants then reported for the second testing session, T2. Each training session, subjects were required to complete the testing procedures and the results recorded at the end of each session. To determine if there was significance between the three trials, a one-way ANOVA test was conducted for each variable: 1 RM squat, 80% squat, reps at 80%, 1 RM bench, 80% bench, reps at 80%. The alpha level was set at 0.05. As shown above, there was an increase in the results from the baseline to trial 1 in almost every test, an exception to 5 for every PLA. This shows significant support to the first hypotheses, stating that there would be an increase in the results for the second trial after taking the placebo. PLA 4 showed in more than one case that there was, however, a decrease in results. As proven in the information provided previously, this could be due to the fact that the subject doesn't feel as though the pill is working effectively. Generally, the more the subject believes it to work, the more effective it becomes. The second hypothesis, which states that the results should reduce after the subjects are made aware of the placebo, is also supported, as a majority of the results are reduced. However, there are still a significant amount of occurrences where the results were increased furthermore. This could be due to the fact that over this period of time, the subject's muscular strength and endurance had been improved, therefore giving them the capability to improve their results. This shows that the placebo effect does in fact work and could be used more often by doctors or other health workers to benefit people in the future. In conclusion, it is believed that this study is important. It has provided information on the placebo effect and has proven that this effect does work. The hypotheses have been proven somewhat correct in that when given a placebo, then the subjects generally received an increase in results for the second trial, and that when the subjects are made aware of the placebo, the results decrease for the third trial.